Rob Brantley, kinesiology student at Cal Baptist University. I'm here with my lovely assistant, Mylene Brantley. Today we're going to be demonstrating rehabilitative exercise for a meniscus tear. So the exercise that we're going to be demonstrating is a quad extension with a band as resistance. This is performed so that the athlete can reintroduce the concentric and eccentric contractions of the quadricep muscles that help stabilize the knee. It's also used to strengthen those quadricep muscles depending on the rep ranges and the amount of resistance on the band. It's a preferred method to using the machine for quad extensions. The machine, because of the way that your legs have to go in, there's the pressure put on the tibia from the machine creates a shearing force within the knee joint, which is the one thing that we're definitely trying to avoid in rehabilitating a meniscus tear. So back to the banded quad extensions. We're going to go ahead and go through the proper setup. So my assistant's going to come over here to the band section that we have set up here, and we're going to go ahead and have her put her foot through so that the band, the resistance, is put on the posterior side of the leg. This is going to go ahead and protect that knee joint from any sort of shearing forces that might be happening inside the joint. So from here, we're going to want our patient at about 90 degrees, approximately 90 degrees, or a little bit less, of knee flexion, which puts them into a setup that resembles that of a lunge, which could be a common fault. The athlete is not performing a lunge, so a lunge would look like this. And there isn't much resistance being generated from the band. So that we want to focus on the quadriceps. So she's going to contract the quads to extend the knee and isolate those quadricep muscles against the resistance of the band. Very good, Mylene. So she's going to perform this at about 10 to 15 repetitions, kind of like that strengthening but also muscular endurance creating effect at those rep ranges for about 3 to 4 sets. The athlete will probably do this 3 to 4 times out of the week, providing adequate time for recovery in between those days or subsequent days. But when the athlete kind of masters this part of the exercise, we can begin a progression. So we're going to go ahead and bring Mylene. Okay, so progressing from the quad extension with the band, the athlete can be permitted to perform a more dynamic exercise. This one being specifically the lateral step up, where Mylene is going to be able to reintroduce those contractions of the quadricep through a dynamic lateral motion specifically. This is going to help with the development of the athlete's proprioception with the balance portion of the movement on a single leg. It's going to help that neuromuscular connection come back, moving in a dynamic motion while contracting. And it's also going to assist in further strengthening the quadricep muscles. So we're going to go ahead and discuss the setup. We're going to have Mylene set up laterally to the step up here, where she's going to begin in simultaneous hip and knee flexion, and then adducting to the top of the step up, where she'll then use the quadricep muscles to extend the knee and extend the hip, bringing the rest of her body on top of the step up for the concentric portion of this exercise. She's then eccentrically going to flex the knee and flex the hip in a lateral motion, bringing herself back down from the step up. So she'll perform this exercise around 6 to 10 times with respective intensity to go ahead and help that hypertrophy or strengthening stimulus on the quadricep muscles. But this has been progression from the quad extensions exercise, and also adding that sets wise, three to four sets will be sufficient. 3 to 4 times out of the week will be very sufficient, and also adding that adequate rest time to let the muscles kind of heal and grow, and let the knee heal as well inside. All right. Thank you, Manny.